So I'll be performing hand hygiene and put PPE if indicated so that we can prevent the spreading of microorganisms. So, hello ma'am, I'm Wansi, your nurse today. How are you?
I'm good.
So, may I ask what is your name?
I'm Eliza and Ikaw.
So today, Ma'am Eliza, I'm going to do an assessment of your musculoskeletal system of your upper extremities and lower extremities. Is it okay with you?
Yes.
So, first, we're going to note the range of motion, muscle mass, and strength. Next, I'll be assessing your vascular system. As I observed, it is warm, no edema or lesions. Next, I'll be checking your capillary refill by depressing your nail bed. As I observed, when I release your nail bed color regain into 1 to 2 seconds. Then next, I'll be palpating your brachial and radial pulse. So it should be equal, regular rate and rhythm, no bounding amplitude. So I'll be testing your sensory. I'll be doing a sensory testing. So, ma'am, may I request that you should close your eyes. So, as I observe, both sides of the body map and any areas of sensory loss. Next, I'll be doing the light touch sensation. So, I'll be touching a cotton and tell me if you feel the touch.
Yes. Yes. Yes.
Okay, next, I'll be doing the pain sensation. So, I'll be using a broken swab test. Tell me if it is sharp or dull.
Sharp. 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 Dull. Dull. Sharp.
Okay, thank you. So, as I observed, you identify if it is sharp or dull. So, it is normal. Then, next, I'll be going to assess for temperature sensation. Just tell me if it is warm or cold.
Warm. Cold. 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 Warm. Warm. Cold.
So, as I observe, you identify whether it is cold or warm. No abnormalities note. Next, I'll be assessing the vibration sensation. So, just tell me, know if you feel the vibration. Then, again, tell me again, know if you don't feel the vibration anymore.
No. 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 No.
Okay, thank you. Next, I'll be assessing the patient position sensation. So, close your eyes. Tell me the direction. Tell me the direction of your fingers.
Up. Down. Up. Down. Up. Down.
So, normally, you identify the movement or the direction correctly. So, no abnormalities Noted. Next, I'll be doing the touch discrimination test. So, we're going to do a stereognosis test. Okay? Tell me if you identify what kind of thing I'll be going to put in your palm.
Coin.
So, you identify the thing correctly. Next, we're going to perform the grapisthesia test. Then, I will instruct, we're going to, you're going to identify, what I'm going to write in your hands.
3. 3.
So, you trace the number correctly. Next, we will be doing the 2-point discrimination test. So, you will tell me if what you're going to note the distance, if it is less than 5 millimeters.
1, 2, 1, 2, 1, 2.
So, okay. Next, we're going to do an extinction test. So, you're going to identify if you're going to identify where I touch you. So, you identify well where I touch you. No abnormalities. Next, we're going to do a motor function test. But first, we're going to assess your deep tendon reflexes. So, relax your arms and remember to grade the reflex on a scale of 0 if it is absent to 4 if it is hyperactive. I will begin in the bicep. So, normally this causes the forearm to reflex. Next, I'll be supporting. We're going to test the tricep reflow as I observe your upper arm. So, it should be illicit forearm extension. Next, I'll be doing the brachioradialis reflex. So, I'll be here. So, next, I'll be doing we're going to do the cerebellar function of the forearm. You pat your hands at your knees, facing and upward first, then downward. So the movements is coordinated and equal. Next, you will going to touch your thumb to finger, the same hand, then reverse direction. So your rapid skill movements quickly and accurately. Next, we will going to do the point-to-point localization using the finger-to-finger test. So, touch my finger to your nose. So the movement is smooth and accurate. Next, we will doing the finger to nose test. So, stretch your arms and touch your nose with one index finger to the other. Gradually increasing the speed. So now, we will be assessing the leg assessment. So we're going to note the range of motion, mass, and strength. So we're going to assess the vascular system by inspecting the skin color, condition, hair distribution, and toenail integrity. So as I observed, there is no abnormalities such as asymmetry, venous patterns, lesions, or edema. So using the back of my hand, I will be checking the temperature of your legs. So as I observed, it is warm and symmetrical. Next, I will be doing to compress the calf of your muscle, again the tibia. So as I release the pressure and the door flex the patient's foot, neither action should cause pain. Then next, I'll be palpating your peripheral pulses in your legs. So I will be palpating the femoral pulse and find the artery halfway between the symphysis pubis. So I'll be compressing and release it gently. So now I'll be going to locate the popliteal pulse. So bend your knee and feel the pulse in the popliteal fossa. Next, I'll be palpating your posterior tibialis. So, as I assess the dorsalis pedis pulse by palpating the lateral to the exterior tendon of the grade 2. So, I'll be checking for the edema by pressing over the tibia or medial malleus for 5 seconds. So, normally, finger pressure does not leave an interior or pit. If thus, grading the pitting on a scale +1 of the mild pitting to +4 to the severe pitting. So next, I'll be assessing your light sensation, temperature sensation, vibration sensation, pain sensation, and your position sensation. So we will going to motor function test or assessing deep tendon reflex. So I'm requesting you, mom, to please sit down. So I'll be assessing your I will going to test your quadricep reflex. So the patient the lower leg should extend and the quadricep should contract. Next, I'll be doing the test for Achilles reflex. So, the normal response of the plantar flexion. Next, we're going to test the plantar or Babinski reflex. So, lay down and so the normal response of plantar flexion with no to fanning or grade 2 dorsiflexion. Next, I'll be doing the um I will be checking if your reflex are hyperactive. So I'll be going to check your clunus. So is an abnormal pattern of rapidly alternating involuntary muscle contraction and relaxation. Next, we will be doing the cerebellar function test. So it is also known as the heel to shin test. So um, place your one heel on the opposite knee and slide it down to the ankle. Like this. So, you're able to do this in a straight line on the shin. Next, we're going to do the gait and gross motor function test. So, stand up, then try to walk 10 to 15 feet and turn back towards your legs. Okay, move. So your movement is smooth and coordinated. Your arms swing freely and turn without losing your balance. Next, we're going to do the Ramberg test. So, um, um, please stay at least 20 seconds. So you balance your body, um, you balance your body freely. Next, we're going to do the tandem walking. So have um, have your walk heel to toe straight line. So you walk straight and you balance your body. So now I'll be removing my PPE and I'll be washing my hands to prevent the risk of spreading of microorganisms. So um, as I observed the the findings of your assessment of the musculoskeletal system is all normal. So, thank you for your cooperation and God bless.